Good evening, everybody, wherever you may be seeing me this evening. You're welcome to another webinar series. I remain Badakinroda Moturayo, team lead of Team Favorite Nurse, and out of our webinar series that I've planned for you, we have another amazing team for today. We have an amazing guest for us today, and our theme for today is the eyes of it. We're going to be discussing about eye health, why we need to take care of our health, especially the eyes, because they are the window to the world. With our eyes, we'll be able to see a whole lot of things. We are able to see a whole lot of things, and no matter who we want to become, no matter our dreams, our vision, if the eyes is not seeing well, the eyes is not functioning optimally as it ought to function, there would definitely be a deviation from whatever our plans may be. And I don't want us to have a deviation in our plans. That's why Team Favorite Nurse brought this unique topic for the webinar series tonight, and we'll be having an amazing guest with us this evening in person of Dr. Nelson Okeke. I know you've already seen publicity on that, and that's why you're here tonight. So I want to say again, welcome, welcome, welcome. So in case you're seeing me and you've not invited someone to join the live, please do. We'll give you 1-2 minutes for that. We want you to invite people. Make sure you invite people before we start. So I'll just give us 1-2 minutes for that. So I'm already seeing people joining in. I'm already seeing people joining in. We can do better. Let's invite more people. It is all about our eyesight tonight. So I don't want any of us to miss out tonight. So I'm still waiting for us to invite more people. So before that time, I'm going to give, this word, you're welcome. I'm going to give like 2 minutes for that, why I tell you more about Team Favorite Nurse. Team Favorite Nurse is a non-governmental organization. It is all about nurses, student nurses, staff nurses, and every other form of nursing professionals that you may know. We are burdened with the community health. We go on outreaches, we go on community outreaches, we go on volunteer partnership with other organizations such as Aware, such as females around the world, and it has been all shades of awesomeness. This is what we do at Team Favorite Nurse. So now, as I rightly said, I am your host for tonight. I am Rhoda Badaki Moturayo, and I am a registered nurse, registered midwife, registered public health nurse. I love public health, and I have a bachelor's degree in nursing science. So tonight, let me welcome our guest. Our guest is Dr. Nelson Okeke. A little about Dr. Nelson. Dr. Nelson Okeke is a medical doctor who graduated from the University of Ilorin in the year 2015. He is a senior registrar at the Department of Ophthalmology, University of Ilorin Teaching Hospital, and is married to the wonderful Dr. Ketiana Okeke. So with typing ovation in the comment section, let us welcome Dr. Nelson Okeke.
All right. Thank you very much, Nurse Rhoda. It's good to be here. Thank you for having me, and kudos for the great job you've been doing with your team so far. And I believe the impact of public health cannot be overemphasized, and it's good that you are doing this in every way you can. So, well done, and good evening to everybody listening, from wherever you may be listening. My name is Dr. Nelson, and by God's grace, within these next few minutes, I'll be discussing the topic before us this evening, or whichever time it is, wherever you're listening from. So, the focus is to prioritize eye health in a modern world for a brighter future. It was a topic I was given to discuss, and I think it's very, very crucial at this point. It's very, very important at this point because um, we can't ignore the fact that the world as we have it now, this digital age, is quite changing, and trends are changing, and with all the online marketing, online jobs that people do, and all, we get exposed to a lot of things. So yeah, we need to really understand: is there any way this thing might be affecting my eye or not, or are the things we hear about how it affects our eyes, are they true or not? Okay, in what way can I prioritize my eye health, okay, going forward? So yeah, that's basically what we'll be doing, and whatever I'll be saying here is not actually exhaustive. Nosroda gave me a long list of things to talk about, and I was telling her that I honestly don't know if the time will be sufficient. So what we'll just do is just say a few things, and maybe questions might arise, but I'll try as much as possible to briefly touch on things I consider very important. Okay, so this will be the outline for our discussion, and let me just start right away. So, as we all know, the eyes are important organs. They are paired organs that are located in the orbits, and people say they are like an extension of the brain. And maybe you understand that. For those of us who probably are in the medical line, you understand that. But I'll still try to break that down when I go to the next section, but I will try to explain that. But yeah, the eye is more or less like an extension of the brain, and it's very important for our eyesight. And the way, for just like a form of definition, eye health, what I would emphasize about it is that it's beyond just seeing. Yes, seeing is one of the major functions of the eyes. Okay, it's very important that we see. What's the or one of my teachers used to say, what's the use of the eye if it does not see? So in everything we are doing, we want to make sure that the patient sees. But I'm saying even people that are seeing can still have eye health challenges. So that's why it's beyond just sight. There could be other aspects of the visual system. There could be other aspects of the visual, like the whole eye or the adnexia. That means the tissues are surrounding it. There are many things about it that could give things discomfort. So you might underestimate the power of your lashes. When one of your lash just mistakenly misdirects and touches your eye, the front part of your eye, it can give a lot of discomfort. There are some people that have to come to the hospital because of that one lash that has started touching the eye. So they are still seeing, but I'm saying that tiny thing can bring a lot of discomfort. So yeah, there's a lot about eye health, and I'm just trying to let us see that it's not just about vision. Vision is very key and very important, but beyond that, there are many other things that will make people seek care for their eyes. There are many other things that people might need to pay attention to about the eye so that they will benefit maximally from it, and it will not be a source of pain or a source of discomfort or a source of concern. So, in prioritizing it, we need to I just put these questions here that the truth is that because this organ is the only means through which we interact with the physical world, or the major means through which we interact with the physical world. From our eyes, we can interpret signals, we can see things. You can be driving and you see that, oh, this green light says stop. You can interface with your phone, you can interface with anything, and it feels like it is key to whatever anybody wants to do. So, most people have that. They don't joke with their eyes, or ideally you would think or you would assume that most people will not joke with anything that has to do with their eyes. Do you understand? But in the real sense of it, we still find poor health seeking behavior in eye health. And what could be the reason for this? Sometimes it could be that they don't know enough to seek help. They don't know enough to know that this thing I'm experiencing, maybe it's a danger sign. So it's not as if they don't value the eye, but sometimes the lack of information does not arm them with the right mind to make that choice, to make that decision to seek help. Okay, so do they know enough? And also, what they know, is it right knowledge enough to start with? Because some people know that there's a problem, but from what the misconception they have or what they know is that this is how you approach this problem. You will hear people saying, oh, once you have red eye, use your early morning urine to wash it. And people in this century, people are still doing that. So is that knowledge, is it right enough? Do they know the harmful effect of that herbal concoction or that leaf that they are pressing into their eye? So apart from having the knowledge they even have, how true is it? How correct is it? I don't know if you understand what I'm saying. So these are some of the things that might influence how we prioritize it. Okay, it might influence how we pay attention to this particular thing we are talking about this evening. So, and this topic is quite particularly important, like I said in the introduction in the beginning, that it's the phase we are in now. Even children, babies, toddlers, infants, most times they're already grabbing, you know, tablets, they're already grabbing phones, they're already engaging with this thing. So we want to find out, okay, is this actually harmful, even as adults? Screen time, does it really have an impact on our eye health? Okay, so in this modern world, how well can if it's doing some damage, what's the damage it's doing, and how can I react appropriately? How can I prioritize my health with my choice? Okay, then also, because of the advent of the internet and so many things, you easily see many people come up with lots of information. You see lots of broadcasts, messages on WhatsApp. You see many TikTok videos of some influencers. Many people might just say so many things. So lots of information might be flying around, and in a way, it might be good that, okay, people have enough information, like from this avenue now. This is probably being streamed live, and people might see. Some people who are not live might see it later, and they will get information. But the truth is that in the multitude of that information, what are the chances that there wouldn't be some misinformation? Okay, what are the chances that people might not know the wrong thing from coming from a seemingly right source? And if you get me, so I'm just trying to show us, like, come on, what, like, the burden or the scope of the matter when it comes to this modern day issues with eye health. So, having said all that, I'll start with briefly with an anatomy of the eye, or maybe a physiology too. But the main thing, like I said, is that the eye is the organ for sight. Well, I don't know. I really wish my pointer. I'm using my the arrow here to point some things. But if you look at the front, it's not obvious. But if you look at the front part of this structure on your right, yeah, that will be your right. Yeah, the one that looks like a cut section of the eye. You'd see that there's something at the front. It's like a glass. We call it the cornea. Okay. For light to really make any impact or have any effect, it has to pass through relatively transparent structures. I mean, there has to be once there is an opacity, once there's something that is not transparent, that's not allowing light to pass through, it defeats the purpose of that light reaching where you want it to get to. I don't know if you understand. Like, I want to shine light on this laptop, for example, and there's an obstruction. The light will not get to the laptop. Do you understand? So I'm trying to say that the medium for which the light is passing has to be very clear. So the front part of the eye is the cornea. So most of us, when we look at the eye, if you look at that image on the left, you would see a black thing. Okay, you just see that, oh, this person's eye, this person has black iris. But the truth is that in front of that iris, there's actually a cornea. There is something like a glass that is covering that iris. Behind that cornea, you now have some fluid that we call aqueous humor before you now get to that iris. So that black part of the eye you are seeing on this image on the left is truly not just the direct thing that you are seeing. There is actually a cornea covering it that is transparent. So when the light now passes through that, it will now pass through a hole in your iris that we call the pupil. So from there, it enters the eye and goes to fall on the retina. So when it falls on the retina, there are lots of, I will not bore you with all the details, but there are some layers of cells there, some neuronal conduction would happen, and then all the signals of what you are seeing will be sent through the structure at the back of the eye that you are seeing labeled as the optic nerve. You see them writing CN2, that's cranial nerve 2. Okay, that will be what will now take it to the brain. So in a way, whatever you are seeing will be taken by this optic nerve to the brain for interpretation. And in the way the eye was developed, the way the eye developed embryologically, it was almost like an extension. The forebrain, it was as if there was some part of it that were branching out to give the eye. Let me just put it that way. So in the research of it, the eye is almost like an extension of the brain. There are neurons that connect that eye to the brain. Okay, so for anybody to see clearly, all these things have to be clear. From the cornea to the pupil has to be open and round and open. And as that pupil is open, there's a lens behind it which is also transparent. Okay, and many of us think that we usually assume that the lens is the only thing that refracts light in the eye, because everything that is entering the eye, it has to be focused on a particular part of the eye where it will really the neurons there will then take it to the brain. It's not every part of the eye that has equal amount of photoreceptors and equal amount of sensitivity. So the part of the eye we call the fovea is the part that will receive most of this light. So the elements, the lens, will help to refract this eye and bring it to focus. I hope my terminology are not getting too difficult, but I'm just trying to explain better that. But beyond that, the cornea too contributes to short two-thirds of the power, refractive power of the eye comes from the cornea. So the major lens of the eye is actually the cornea, not the lens that we know. So that's how important the cornea is. Do you understand? So yeah, apart from the transparency, I'm saying it also brings something to focus, the light to focus for you to see it. So that's how the light works. So there are some powers, there's a way that your eye too can help you focus, and it can change the power of the lens in a way. When you want to focus on something close, that one called that one accommodation. There's a way that you can just the way a camera of a lens would focus if you want to focus on an image closer to you. There's a way you would probably increase the power of that lens. You understand? Or the change the focus. For some of us who are into photography, you might understand what I'm saying. So in the same vein, if the eye wants to see something very close, it will accommodate, it will change the shape of that lens to focus appropriately. Do you understand? Yeah. So sometimes the whole refractive components of the eye might have issues. That's why you hear us talking about refractive errors. I will talk a little on them when I go forward. Whether it's myopia or hyperopia or whatever, there might be refractive errors that come if the light is not being brought to focus appropriately on the right place in the fovea, the retina. I hope we are together. So yeah, one thing I'll quickly mention before I leave this aspect of the anatomy is that, as you can see this eye here on this picture on the left, it is not dry. The surface is not dry. It's not like your skin. There is what we call the tear film that is being produced. The eye produces tears, and sorry, the tears is not only for crying, emotion when there is emotional heartbreak. The tears actually have a function of lubricating the eye continuously. And once the tears are secreted from the tear glands, the eye will blink. An average human being blinks about 7 to 15 times within a minute. So that blinking helps you spread the tear film over the cornea, over the surface of the eye to make sure it's not dry. Because if it's dry, it can affect the clarity. I told you the medium has to be clear. You understand? So I forgot to mention there's a vitreous cavity, but I think you shall see for now, like behind the lens. That one too has to be clear for every light to pass. So, but for the tear film, it will wipe the surface of the cornea to make it clear. Do you understand? So your blinking is not just because you want to blink; it's doing something of spreading that tear film over the eye. Do you understand? So averagely, once that tear is produced, any excess would drain through. If you notice, towards the nose, there's a part we call the lacrimal apparatus. It will drain through there. Let me know what you thought that it is. But I'm trying to let you know that there's something about the eye that produces this tear film that has a function of lubricating your eye. If anything affects this lubrication of the eye, if anything affects how often this eye is lubricated, it can give some form of dryness that can cause discomfort. So I want us to understand that aspect because it will come into play some of the things I'll talk about when we go forward. So let me just quickly run from here because of time. Okay, so well, like I tried to say in the beginning, we cannot finish everything, and what I've put in this slide is not particularly exhaustive, but I just thought to mention some of the things that might be common eye health problems, even in Nigeria. Okay, the truth is that cataract is still one of the commonest causes of blindness all over the world. Okay, But in its own case, the good thing, let me say the good thing about it is that the kind of blindness it causes, we can still call it um, reversible. It can still be reversed. Okay. But glaucoma in itself causes an irreversible form of blindness, the commonest cause of irreversible blindness globally. And the story is not different in Nigeria too. So cataract is commonest cause of blindness generally, whether reversible or irreversible. But glaucoma is the commonest cause of irreversible blindness. So glaucoma is, we are almost always more afraid or more concerned about screening. And the problem about glaucoma, I'll just talk about that, is that it's basically asymptomatic in most cases. Okay, so glaucoma, cataract, but refractive errors are also very common. They are very common. It's one of the major causes of visual impairment. People present to the hospital many times because of refractive errors. Okay, so refractive errors are either myopia, hyperopia, or astigmatism. Okay, like you are trying to um, focus on that focus something you are seeing from a distance on your retina, on your fovea, the particular place you want to be focused, but somehow your eye, the power of your eye is either too much such that it brings it to focus before that retina, or it's either too small, let me just use that terminology, that it brings it to focus behind the retina. All of this is in relation to the length of your eye itself, because the length of the eye too also has a role to play in whether the light will be focused, whether the lens is appropriate for the power or not. Okay, so but in the reasons of it, refractive errors are very common, and the way to present could be poor distance vision. It could be poor, the person can't just see the board very well. You understand? And sometimes it might come, depending on the type, it might come with some pain because of that activity. The eye is now trying to focus, and they can come with some pain, especially for hyperopia and astigmatism. So there might be some pain, there might be some photophobia, might be some watering, there might be some discomfort. We call those things as stenotic symptoms. So those can follow refractive errors most times. Okay. Then some people put presbyopia under refractive errors, but in the reasons of it, they're actually not refractive errors. Presbyopia, just like I was explaining to us, that accommodation. Presbyopia is just like an age-related loss of accommodation. Ideally, you can see something within arm's length very well because your lens can focus it. But most times when people enter the age of 40 years, we discover that the eye cannot focus on that thing very well. They will have to shift it away from their eyes to see it very well because the elasticity of the lens capsule, the lens that will normally change shape, is now becoming more rigid. The capsule is becoming more rigid and is not able to accommodate to focus as it used to. So the person would have to shift the thing further away so that it can focus well, but it can't bring it closer. So that's presbyopia. It's an age-related thing. So most people, that's why you see many people when they are beyond 40, 50, you see them using glasses to read. So let me not dwell too much on this. But another common thing is allergic conjunctivitis. It's also common in this age group. Age-related macular degeneration is also very common, but it's more of a Western problem. It's one of the commonest causes of blindness in developed countries. But for us, we still have a fair share of age-related macular degeneration. Okay, so the same for, let me quickly go to the next slide. For children, I try to focus on them too because there's a way that sometimes we leave them out of our discussion. But it's very important because some of us might have younger ones, might have nephews, might have our own children. Okay, I'm assuming we are probably to have a mixed multitude, might not just be students, but even if you're a student, I'm saying you might just be a neighbor to someone who has a child, and the child has an eye condition that the mother didn't even know is that serious. So that's why I will talk about this and I'll draw out some key things to note. But pediatric cataract is very common, even though age is the commonest cause of cataracts. Age-related cataract, senile cataract is the commonest form of cataract, but we can see cataract in children. Although some children can be born with cataract, and it will be like a whitish speck in their eye. It can be born with cataract. So, of course, picking them early is very important because if for children the eye is developing and the patency of all those medium, whether the cornea, the lens, or the vitreous, the patency of all how transparent the eye is important in the development of the eye. This visual stimulus entering the eye is important for that eye to develop normally. So a child who has a cataract and is not treated, that child's vision, even if you later remove it some years later, it might not be as perfect as the other eye because what we call amblyopia or lazy eye has already set in because the eye didn't develop as well as it should because it wasn't given the right stimuli that it needed to develop. So that's why we don't joke with pediatric cataract. We don't joke with it at all. Same with childhood glaucoma. That could present in many ways, but one of the commonest ways is that the eyes might look so big when the child is born. I would call it blue eye. The eye will look big and up. And then there might be some other cloudiness of the eye. Some of them might even have watering. That might be the first thing they'll notice, that the eye is just watering and they have some aversion to light. So it depends. But these are some of the ways it might present. Then children also have refractive errors a lot. Then retinoblastoma is one of the commonest intraocular tumors. I mean, eye tumor that children would have, and it's quite rampant. And the challenge about it is that it can present almost, you might present with something that looks almost normal. That this child's eye, there's nothing there. The child is still seeing, but you just notice that there's something white. I used to see in the eye sometimes, occasionally. When maybe I'll talk more about um, very soon. So allergic conjunctivitis too is also quite common in them. So I've decided to just speak cataract and glaucoma because they are, like I said, they're one of the commonest. So I'll just say a few things about them before we now go into some other matters. Like I talked about cataract, you can see this whitish part of the eye in this man. It's in both eyes, but the right eye is actually dilated. So you can see it, you can appreciate it better. It's behind the pupil. Okay, so that's the classical way that cataract presents. It's like a whitish thing at the eye, and the patient will come presenting with poor vision. They'll say, I can't see. Some of them might start gradually. They might be saying that, oh, when someone is far, I can't see them. When they come closer, I'll see them. Some of them might describe it as cloudy vision, that the vision just looks white. Everywhere it looks as if, oh, there's snow or there's harmattan. Yeah, that's part of the way it's presented. And for some people, it might just present in such a way that, they might just notice that probably when they are inside the room, maybe it's usually more at night that they see things better. There are different forms. That's that one is common for the one called posterior subcapsular cataract. It's as if they might be it's in the evening, during the day, whenever there's bright light, it's what they can't see. But whenever it's in the night and the eye is dilating, when they're in a dark place, they can see better. So there are different ways it can present, but the primary thing is that there will be poor vision. So when they come with poor vision, and like I said, it's commoner in old age people. There are many other things that can cause it. Trauma, use of steroids, so many other things can cause. That one will be secondary cataract, but primarily the major cause is age. So it's an age-related thing, and those are the symptoms I've described. Like I said, that it's age-related, but it can affect all age groups, and the primary treatment is surgery. Okay, people come with so many stories. Some patients will come and they'll tell you that they told them that there's a drug that can cure cataracts. There's no drug yet. There are no eye drop that can cure cataracts as it stands. Okay, the solution is to do surgery to remove it. However, in some cases when it's probably just starting or something and then the vision is significantly poor, but you do a refraction and you discover that refraction can improve their vision, and maybe they are not ready for surgery or whatever, you can actually give glasses. Glasses can improve their vision for a while. If it does not progress, maybe fine. To understand. But yeah, surgery is one of the mainstay of the treatment. Then the thing about glaucoma is that we call it the silent thief of sight, and that means most times it's when it has already taken the vision that it will be known, because it does not cause any early symptom. The way I told you, cataract will start gradually. It's going, this vision is poor, then it will be progressing. It will be painless. It will be progressing, and then you just discover that this person has a mature cataract. Yes, but glaucoma most times, by the time the patient will see the vision loss, it would have been so advanced, because the way glaucoma affects the optic nerve, that nerve I was saying that connects the brain, and sometimes in such cases it can be related with high intraocular pressure. The pressure in the eye could be very high too. Okay, so but whenever that damage is happening, it would begin little by little damaging those nerves until a point where, I mean, it will start affecting the vision from the periphery. If you look at this picture to the right here, that's how it starts. It will be affecting the outer part, such that the person might not even know because he's still seeing clearly. Everything is looking at the front, he's seeing it, but probably when he's walking, he might bump into objects by the side because he's not seeing the peripheral side of his vision. But if all of you, if you look straight up ahead without focusing on the side, you will see whatever is by your side. If you place your hand like this and you're looking straight ahead, you will see your hand without focusing on it. That's because your peripheral vision is good, I'm assuming. But if you do that and discover that somehow I can't see what is beyond this side, that shows that probably something's already happening to the peripheral vision. And that's how glaucoma starts. Usually it starts affecting from the peripheral vision until it now comes to the central part. So by the time it becomes so obvious that it's already encroaching the central part, sometimes that's when some people notice it. But some of the telltale signs, some of the early signs that you might start bumping, the person might be bumping into objects, it might be coming and the person will hit you. The person will not, the person might be driving a car and will brush another parked vehicle and you will not know because he's having poor peripheral vision. So some of those signs would could actually be a pointer for a reason that the person should have that suspicion that, okay, there's something wrong here. I don't usually brush people this way before. So, but the challenge with glaucoma is that when that's going to that stage, most times it's already advanced. Okay, so the best we can do is to try to slow down the progression with our medications or surgery or whatever we decide to do. So I hope I'm still audible, right? Okay. So yeah, like I said, mostly asymptomatic, and sometimes there can be family history of it. So if someone is being treated for glaucoma, it will usually advise your first degree relatives, maybe your children, your siblings, try to encourage them to also check their eyes. So eye screening, there are many reasons why you should screen your eyes, but if someone in your family has glaucoma and it's confirmed that the person is on treatment or some other person has even lost vision because of it, that could be a pointer to why you should actually check your eyes, because while it is not particularly hereditary, we cannot say, oh, is this autosomal recessive, autosomal dominant, whatever. It's actually been found to be familial most times. So it's really advised. And the treatment is that medical surgical therapy. There can be use of lasers in some cases and all. So yeah, I feel this is also important, like I was trying to establish, because most times we are concerned about children, and why even in public health you want to advocate for them is that they cannot defend themselves, they cannot make a case for themselves, depending on the age though. But yeah, most times they cannot really tell you when something is wrong. So the caregiver needs to be quite observant. And for example, one of the things that the children will have could be reduced vision. And you now ask, how will you know that the baby has reduced vision? So that's the thing. There's a way the eye develops. There's some milestones. There's some things that happens in the eye that will raise your suspicion that, okay, this child should have actually achieved this by this time. Do you understand? So reduced vision could, because normally around maybe 2 3 months, the child should be able to look at the mother's face when sucking. In short, from about 4 weeks and thereon, the child should be able to look and try to, gaze around. If you are dangling something in front of it, the child should be able to probably look at that. You understand? So sometimes in you just by interacting with a child, you entered someone's house to greet them, a 1 month child, you carry the child, and then the eye is just looking and it's not even following whatever you are trying to. It's not the child is not looking at your eyes or whatever. Those are things that one should actually take note of. But sometimes if women are giving birth to their children for the first time, and maybe they've not really had experience raising children, they might not know some of these things. So having people who have that knowledge, having people who are I can't count a lot of people that have come to the hospital and they'll be like, it's actually my neighbor's wife that I noticed this thing. That kind of thing. Or that's someone I'll just say, my mother-in-law was one that said this child's eye is not straight. Some things the mothers might not pay attention to, but yeah, I'm saying that this information is actually important because from the little we know, we can make great impact. You can never tell what that your suspicion can do to the life of that child. I mean, just suspecting that this thing, so there's nothing off about the way this child is not responding. And the thing about vision is that you need it for every other milestone to come, to follow. I mean, for example, a child that is not seeing, the child will find it hard to actually sit at the exact 6 months they're supposed to sit. The child will find it hard to actually walk at 1 year because you need your eyes to interact with the environment and do whatever you want to do. So you just notice that this child is just lying down. This child is not doing so many things. Many things are being delayed. Many of the development of the child are being delayed because of that vision problem. Do you understand? So yeah, that's why it's holistic if vision is addressed, if vision issues are addressed in children early enough. Then sometimes it could be that there will be something whitish in the eye that will notice that this is actually off, this is abnormal. Some of them actually might look so small that the parents can almost overlook it. That it's not that serious. But as small as it is, it might be at the central part of the vision of that child, and it will be blocking the vision of that child. So a whitish speck in the eye of any child is never a good news. It's better to go to the hospital and discover that it's very small and it's not that visually significant than to assume that, oh, everything will be fine. Okay, so seeing that, we need to raise the alarm. And then another thing again is sometimes you might not even see anything white, but you just discover that in the night whenever maybe you are turning on your touchlight or whatever, the child's eye will just glow at night. You know the way the eyes of cats used to glow at night. We call it like cat eye reflex. So you just discover that whenever you shine, like you just see something shine in the eye of the child. It could be a retinoblastoma that is just starting. You understand? It's already yeah, like when I mean retinoblastoma is an eye tumor, a cancer of the retina that is starting most times in children. Okay, from first like 18 months of their life beyond and all, they could actually have that. So one has to be very, very observant with these children. Like I said, they will not defend themselves, they will not present. You have to actually note some of these things. So another important thing again is eye misalignment. Don't assume that, oh, the eyes, of course, almost every child or this every human being has some degree of little misalignment when you are born. Okay, but it's not that significant. Not the one that you see it so obviously that this right eye is looking inward, or this right eye is looking outward. Something that is so clear. Do you understand? One has to be very careful because the reason about it is that it might just be strabismus. But what if it is not? Because one of the earliest signs of retinoblastoma sometimes is strabismus. It might not be the commonest manifestation, but it's one of the earliest. The eye will just deviate because maybe the thing is sitting on the fovea and it's not allowing the child to see, and then that eye just deviates. So it could just be a sign. They point at the fact that there's something. So don't just assume that, oh, it's strabismus and it will correct itself. That's another problem. Some people just assume that, oh, whenever the eye is deviating, it will correct itself. It's not always true. And in children, you don't just assume. Whenever there's strabismus in a child, we almost always want it to be checked. Okay, so enlarged or small globe. These are some of the things that outrightly you just discover that this eye is bigger than this other one. It's not something we just neglect in children. So there might be more and more, but I just picked these ones for the purpose of discussion that I feel we might need to just pay attention to. So yeah, this is part of where we are going, and I think there are lots of things to say. There are lots of assumptions. There are lots of ideas about screen time, and at the same time, there are lots of stories, lots of experiences. In the way the world is now, there's nobody. Probably people that are living in remote villages with no internet access, but there's nobody that would not actually have some level of screen time, whether you want to either communicate online or you want to sometimes not even receiving lectures, going for courses, doing so many things, sometimes walking, you might have to just be on your computer screen. So it's part of the package of this age, okay, that we cannot afford staying away from the screen as much as we want to. Do you understand? But then the issue will now be, what's now the impact of what does it mean? What does it do to my eye? Do you understand? Okay, and the symptom I'm having, what does it translate to, and how can I curb it? So the truth is that with prolonged screen time, some of the established things that you can experience are symptoms like foreign body sensation in your eye, as if there are some particles in your eye. Sometimes even watering of the eye. Sometimes there can be pain, aches. Sometimes there can be itching of the eye. Sometimes there can be photophobia, as if you just become there will be pain with exposure to light. So there are so many things that you can experience. Discover that, okay, I'm always working on systems, I'm always doing that, but you can actually experience some of these symptoms. And the truth is that part of why you experience it, if you remember what I was telling you about the tear film, whenever you now the thing about the dynamics of the tear film covering the surface of the eye is that normally some of the tear film naturally evaporates. Okay, it evaporates, and then as it evaporates, you are secreting more. As you're secreting more, your eyes are blinking to spread it. Some of it will evaporate again, you secrete more. Do you understand? But now what happens when you are on screen for a long time is that the rate of evaporation, because of that attention and all, and the rate of that evaporation increases. Okay, the rate of that evaporation increases. That means there will be less tear produced. There will be less tear covering your cornea, covering your eye at that point in time. The second issue will now be that most times when you are attentively looking at the screen, you are watching a movie, you are typing, you are doing something, most times your blink rate unconsciously drops. I mean, you don't blink as much as you would normally because you are paying so much attention. So that one in itself too now adds to the problem because now the tear film is evaporating so much. Secondly, the blinking that should actually spread more tear film is now reduced. And if you get that, so naturally, prolonged screen exposure is bound to make you have some form of dryness of your eye, dryness of your cornea. Now, this dryness is what will cause some of these symptoms that we are talking about. That you just discover that your eyes are just tired. You just discover that, oh, my eyes are just feeling painful. You're just feeling as if they are burning. They are feeling as if there are some particles inside it. All those symptoms, they add up because of this experience of prolonged exposure to the screen, and then this reduced blinking that happens for that. So it's unconsciously we just discover that after many hours of being on system, we would almost always have that eye fatigue. So there's a name for it. We call it digital eye strain, or we call it, some people call it computer vision syndrome. Okay, so whichever way, just the main thing is just that our exposure to the screen can lead to some of these symptoms. So some people, when they have that, they will begin to get worried and feel like, oh, their eyes are spoiling, or they feel like their vision, because sometimes immediately after that, you might not be able to focus on normal things you might read that not read normally. You can't read them clearly at that particular time. Do you understand? Because in a way, the eye is fatigued from that intense work. So people begin to feel like their vision is reducing because they start working on laptop. They feel like there's something damaging their eye. And the real issue is that it's not really like there's a damage outrightly. The issue is just that there's an experience from that overworking. Do you understand? There's an experience, there's something that has happened physiologically to the eye that is making you have that. Now, when that now happens repeatedly, days, weeks, it will become a perpetual problem, to understand. Yeah. So what's now the advice? The consensus, I know probably some of them might have heard of it before, but the rule is what we call the 20-20-20 rule. Okay, that's one thing we advise to people on how to deal with excessive screen time. What do I mean by that 20-20-20? As you can see in this image here, that means if, for example, you want to spend 30 minutes or you want to spend 1 hour online, and after 20 minutes of intense work, it's advised that you take a 20 seconds break. And the 20 seconds break is not that you are closing your eye and you are just walking about to go and take a cup of coffee. No, you're actually intentionally gazing at something that is 20 feet away for 20 seconds. Okay, you are looking at something. If you don't have 20 feet, that's like 6 meters, something that's like 6 meters away. Just look at it for 20 seconds, then you resume. As simple as that instruction is, it can be a game changer in experiencing these symptoms, because you are paying attention. It's part of the ocular hygiene, or part of the eye hygiene that is encouraged. When you talk about ergonomics, talk about, oh, this is your sitting posture, this is how you should sit when you're at work for hours. The same thing applies to the eye. When you are working on screen, that's a rule that is highly encouraged, that give your eye breaks in between that prolonged work. It saves you lots of stress of what we are dealing with. So yeah, let me quickly leave that and quickly talk about some general preventive measures, because people ask questions sometimes that, okay, now if assuming I don't have an eye problem, what's the routine? How often should I check my eyes? Okay, how often should I do a routine eye checkup? What if there's a problem? What if there's something like the glaucoma we're talking about that is silent? Do you understand? Yeah. So it's good to seek help whenever there is a problem. Oh, you're having this itching, you're having something that looks small, and then you go and find out, oh, what's the problem. But beyond that, there's a room for having eye checkups even when everything looks fine. Okay, and I've seen a number of people who just decided, let me do an eye checkup. There's an outreach today. Let me go for this and have my eye checked. And through that, they actually discovered that they have glaucoma, and the pressures were skyrocketing. The pressures were very high, and they didn't know. So because of that decision to check their eyes, they discovered it. So it was a discovery, like an unplanned discovery, that was actually very helpful. So, but at the same time, someone who is very particular about the eye, and maybe any small thing you are unsure of, you go to the hospital. By going to the hospital to complain, you're already submitting yourself to an eye check, because in a standard eye hospital, they are most likely going to check many things. They'll check your visual acuity, they'll check your pressure, they'll check so many things. They'll check your fundus to see if, okay, are there signs of glaucoma in your disc? And maybe your complaint was just that, oh, my eyes do itch me, or I can't see the board very well in class. So I'm saying anybody who prioritizes eye health will, one way or the other, have some detailed eye check in an ideal setting. You understand? But I'm saying, assuming there isn't this symptom, it's very advisable that at least have even once in a year or once in 2 years, you can actually have your eyes checked. You understand? Yeah. So things that we can find out from regular routine eye checkups are diabetic retinopathy, glaucoma, because sometimes people that are diabetic can have some eye problems, apart from the sugar is going up and down and they're having some visual symptoms. Sometimes it might even be something more sinister where there is something called diabetic retinopathy in the eye and they might bleed into the eye if they're not careful. So picking some of those things early are very important. And another thing again, this one is relating to child health, is retinopathy of prematurity. Most children who are born preterm, most times when their weights are below 1.5 kg, okay, it's always important that they have a routine check, even if they have been certified free by the pediatricians that they can go home. Most time the pediatrician usually invites ophthalmologists to check their eye because there's something called retinopathy of prematurity. And I'll not bore those details, but it can blind the eye. That's the truth about it. So yeah, picking those things early is very important. So in those cases, the child does not have any eye complaint, but you're just doing screening. You're just doing eye checkup to see if there is retinopathy of prematurity. So yeah, there are a number of other diseases that one can find accidentally by just routine eye checkup. So usually very much encouraged. So then another thing again is the role of protective wears. It's not part of the things I included, but like I said, it's not exhaustive. But one of the commonest eye problems in Nigeria sometimes can be ocular injury, or two guys were playing ball and then somehow someone used his leg to kick the other guy's eye, and then there is subconjunctival hemorrhage, or there is bleeding into the eye, or there is globe rupture. Many things can actually happen, many injuries, or road traffic accident and someone got eyelid laceration. So there are many things that can happen in the eye. But while you might not be able to protect your eye in every instance, it's almost always encouraged that people who are in occupations that warrant this should actually try to wear these protective um, gadgets, protective goggles. People like welders, and some of them might wait, but some people still don't. They will still be working with their equipment and the thing be sparking and can enter the eye. People that work with some chemicals and all, there can be chemical eye injury that can be very, very devastating. So sometimes it's really advisable if you are in a place or working in a place that might warrant flying of missiles, flying of objects, or chemicals pouring, those hazards that you notice that can happen. It's always advisable to wear protective wears in such cases. Then, well, though it might not be a major problem in Nigeria today, but it's still one of the major WHO focus for developing countries, vitamin A deficiency. It can cause lots of problem for the eye, it can affect the cornea in different ways, and patient can lose vision because of vitamin A deficiency. So nutrition is also very good, and vitamin A. That's why we encourage that vitamin A is good for the eye. Okay. Yes, so to talk about night blindness as well. It's part of the things that good nutrition would actually stop or forestall. So lifestyle changes too are also very important, and it's always advisable to discourage smoking. There are many conditions that smoking is a risk factor for hypertension, and of course, we can have hypertensive retinopathy. Many other things. Even people say smoking is also a risk factor for cataract. Okay, and even but one of the most commonly linked ocular problems with smoking is age-related macular degeneration. People that smoked for so many years, some of them can actually have age-related macular degeneration. So, yeah, it's part of the things that we encourage, and some of these things, as good as simple as they might look, they can actually be sight saving most times. So it's part of what we encourage. So yeah, I'm close to rounding off. I think just a few notes, so a few things about the eye care is advancing, and there are so many changes here and there. New things are over the horizon. New things are rising day in day out in terms of diagnosis. There are many people that are talking about ways to use AI to interpret results of our images. So maybe someone has diabetic retinopathy, you snap the pictures, then AI will interpret whether this is the stage of diabetic retinopathy. So things are advancing in diagnosis. Same thing, teleophthalmology, because of there can be an interface to communicate with someone who is not directly there. And the person will see your results, see your findings from your pictures, your OCT. The person can interpret it. So they are making diagnosis. There are lots of advances, and this is not exhaustive. There are so many more. Same thing with medical therapy. There are some newer novel means of administering drugs that work better, that patient does not have to remember to wake up by this time to use the eye drop. You just put that thing as an implant there, and then the thing is discharging there for like 3 months. So there are so many things that have come to make life easier. Gene therapy is there as well. And for surgery, there are some no while we sometimes the surgeries we do might come with some scars, some ocular surgeries. The way we are looking at it now is that is there a way we can do make it less invasive? Is there a way we can make it with a smaller scar, not just the way laparoscopy came to be when it comes to abdominal surgeries and all. So in the same thing, there are some minimally invasive glaucoma surgeries. Same thing with cataract surgery. There are some that will not use so much, so big an opening. And sometimes the bigger the opening, the more the side effects. They can have some astigmatism after your surgery, and also the world is looking at how can we ensure that in our bid to provide optimal eye care, we are not causing more discomfort, we are not causing more challenges, we are not causing bringing more burden to the patient. So there's still room for more and more advances in eye care. So lastly, let's go talk about some myths. I know I can't exhaust all the myths. Maybe you might bring up some myths that you know or some misconceptions, excuse me, about eye health, but I'll just say a few that I have here. Number one is sitting close to screens. Sometimes some of us growing up, we hear that thing that, don't stay close to the television. It's going to blind your eyes. It's going to say all those things. But I've tried to explain to us what the screen does. But there's the truth about it, as if maybe it blinds your eyes or it does some things to your retina, might not be accurate. But what I would say about that is this: most times when you see children going close to the screen to look at it before they see, and instead of you to be saying that, don't go close, it will damage your eyes. Maybe you should pay attention to the fact that maybe this child is actually not seeing that television at the normal place you are sitting. The child has to go close to see it. So maybe this child actually has myopia. Do you understand? So that should be the thing that okay, the child is you give the child your phone and the child has to bring it close to the face to see it and be like, why are you don't you want to damage your eyes? No, the issue is not about damaging the eyes. Maybe the eye has a problem and the child has to bring it very close to see it. Do you understand? So yeah, it could be a sign of short sightedness. Then of course there's the myth that people always say this, and most of the time I get fed up of hearing it that when the eye problem started, I just used yeast and everything was fine. Yeast does not cure anything. Yeast is not a wonder drug that will make your glaucoma disappear. It's not a wonder drug that will make your allergy disappear. It's not a wonder drug that will make your cataract disappear or make your vision clearer. It's just vitamin B. It's just sort of vitamin B, and maybe it can help your vision to maybe it can help some of, but not particularly like it's a treatment we prescribe as a solution to anything in ophthalmology. No, it's not. So that's one thing we might need to know. I'm sorry if I'm busting anybody's bubble, but many people grew up with that assumption that yeast is always for eye. Any eye problem, they're just gonna use yeast. Is a lie. It's not. There's nothing that yeast does specially. It's just vitamin B. And of course, we use vitamin B in some cases. Do you understand? There are some cases that okay for each macular degeneration, but of course we have a regimen for that. Okay, that will say okay, use this amount of zinc, use the amount of vitamin E, use the amount of vitamin C, and all that. And vitamin B is just generally good for the body, but it's not like it has any special thing you want to prescribe yeast for in ophthalmology. Okay, then another thing again is that most people, once someone has red eye, they just say, okay, it's Apollo, as we call it in this climb, or the meaning is conjunctivitis. Okay, now not all, and this sometimes maybe this is not even the right place because maybe if I'm talking to people who treat, maybe some choose who are in a setting, and or maybe choose my see this here. People who are treating patients in a local setting or something, or maybe some of us who are in the health line and then we just have a neighbor who has red eye and it's Apollo, just go and use eye drop. Not every red eye is Apollo. Some of them might be more deadlier than you think. Some of them might be there and it might just be an angle closure glaucoma that's already damaging the eye. Do you understand? Some of them might even be uveitis. Some of them might be something more. Some of them might be microbial keratitis that's already damaging the cornea. So it's good to not assume. And as patients, if we are the ones, we should not always self-medicate and go and don't joke with your eyes. That's what we are saying. Don't think that because I had it 2 years ago and I used ofloxacin, I used chloramphenicol, it went. Then it's the same thing is coming again. Sometimes the fact that you had it 2 years ago and you're having it again, maybe it's showing that you have what we call episcleritis, and there's something more, there's something systemic that's going on. That's why you keep having that red eye almost every 3 months. Do you understand? So sometimes it might not be, not all red eye is conjunctivitis, not all red eye is something that antibiotic will, or whatever thing you think would take care of it. So it's always good to check every read or have it checked. So even amidst doctors, we'll still have this conversation amidst ourselves that those who are not ophthalmologists, we need to sound it really that don't just assume that every red eye um is conjunctivitis. And some people they would even give steroids. It's not every steroid does not help. In short, in red eye, no, don't give steroid. That's what we say to even doctors that let it be an ophthalmologist that will give steroid because sometimes steroid will do more damage if it is something else and you're assuming oh steroids can work for it. Do you understand? So it's always better to have it checked whenever there's such. Then lastly, some people always say this that whenever you start using eyeglasses, that your eyes will get weaker. Don't use eyeglasses. That's once you can use eyeglass like this, you depend on it for life. Your eye will be getting to be progressing, to be getting weaker and weaker. But there's nothing like that actually. Okay, the eye, or unless it probably you are using a wrong power, that's when it might come some discomfort, and might come some pain, and it will not give you the optimal vision. But if you are using the right power, it's going to correct the refractive error. It will not reduce your vision. It will not make your eyes weaker. It's only helping your eyes. Because the truth of the matter is that by not, if someone has hypermetropia, for example, by not using the glasses, your eyes will be overworking. Even things that your eyes should relax to see, it will accommodate to see it. Do you understand? So in such a person, that eye is already being weakened. That eye is already being exhausted. So some of them, you see them developing presbyopia early because they have used the accommodation all their life. So there is no accommodation research. They cannot accommodate at 35 years anymore. Meanwhile, it should have been maybe 40 years and above. So in the research of it, not using the glasses is what weakens your eyesight, not wearing the glasses. Okay, I think I've used so much time, but practically that's the last slide. And I think I want to believe that all I've said so far is clear. So I will hand over to Nasruda now, if maybe there might be questions or whatever we should think we should go. Am I still audible? Nasruda, I think she's having some network issues. All right, I think we'll just wait a little. I don't know. I don't have access to questions or whatever on the comment section. All right, so maybe we just do it this way. So I can't have access to Sister Rhoda. I don't know how to check the comment section, but please, is it possible to unmute if you have questions and speak? Oh, okay, I've seen the comments. Let me check. Oh, all right. Okay, all right. So, I've checked the comments now. I'm not seeing any question. Okay, sorry, I'm seeing one. Okay, someone said, I once met a child that's about 7 years old. He had reddish eyes and very dark eye cycles. Okay. I asked if he was okay, and his teacher said that that is how his eyes are. What do you think about that, sir? Well, that's very likely to be allergic conjunctivitis. He's a 7 year, probably is a boy or something. There's something with the part type we call venal keratoconjunctivitis, VKC. Most times, because of that, they're rubbing on the eyes. The eyes will just have this blackish appearance, hyperpigmented. Do you understand? So most likely it's an allergy, and the eyes might be looking reddish. The white part of the eye might look a little brownish. And so such child just it just means that the child's eyes are reacting to something. Just the way you have allergic rhinitis, where some people just have catarrh whenever they're exposed to some things, or some people that have asthma whenever they're exposed to dust, they start wheezing. So it is in the same family. So in this case, the child, this eye is what is responding or reacting. So it could actually be allergy. But of course, I don't know. It's until probably the child gets his eye checked that we'll discover that okay, this is probably what's happening. But now you've not mentioned that the child is itching, but I'm just looking at that classical appearance of probably redness and then that blackish cycle. It most likely that's the commonest. It could actually be allergic conjunctivitis. However, maybe the child was beaten, he was punched, and then he has blackish circles around the eye. It could actually be subconjunctival. Could actually be an hemorrhage around the skin. Do you understand? So we never can rule that. The child has to probably be checked. I'm just telling you the possibility. Do you understand? Yeah. Okay. So I've noted that question. Let me see if there's another question. So I think that's. I don't know if there's anybody that wants to unmute and speak. I think there should probably be room for that. But yeah, I think I've answered your question, Afolabi Busola. All right, I don't know if there are any other questions. Any other questions? All right. In the absence of any other question, I think. Well, I didn't start the meeting, but I don't know whether I'll be the one to end it now. But yeah, I believe we've all learned one or two things. I believe that um, would keep on at least using the knowledge that we have, change our personal eye health and bring the education to those around us and help them any way that we can. And yeah, so I believe the absence of any other question means we are done and everything is clear. So I want to thank us all for joining on behalf of the team, and I appreciate all the team members as well on behalf of them. I think we declare the webinar closed. Let's have a wonderful, wonderful night rest. Oh, Sister Oda is back.
Thank
No,
you
so
so
you're welcome.
much, sir. The
I
network
was
was
about to
really
round up
good
for you.
this time.
No
Yes,
problem.
sir.
I understand. I said I was about to give closing
Rand,
speech.
thank you. Thank you so much, sir.
All right.
Please
Yeah.
let us appreciate Dr. Nelson in the comment section for the time that I was able to like join. I learned quite a lot. Yes, I already know that glaucoma it is one of the leading causes of irreversible vision loss, and the major thing is that this glaucoma is asymptomatic. Yes, it is just progresses like that. That is why examination is very key. You don't just have to wait till oh I can't see again before you visit the clinic. So that is that I trust that he has handled some of our questions in my absence. I want to say a big thank you to everyone that joined again. I can't wait to see you in our next episode for our webinar. Once again, this is brought to us by the team Favorite Nurse. Also, thank you to the team Favorite Nurse, our partners, our volunteers. God bless you. I can see Nurse Ademayo, I can see Nurse Divine Ukeze, Miss or Mrs. Afolapi, and Abigail, and every other person that I cannot see, but they are seeing me or once joined at any point. Thank you so much again. I'll see you next time. Bye.